It's already been established that testosterone levels have fallen by over 1% per year since the 1970s, but this study is the first to show that testosterone levels are falling even faster in young men. In this video, I'm going to explain why testosterone levels are falling so fast and what you can do to protect yours. If you're new to the channel, my name is Josh Vecchio. I spent my entire senior year as a biology major during college writing a thesis on trends in sperm counts and testosterone levels, and after finding that both have fallen significantly in the past couple decades, this inspired me to start a men's health coaching company while getting my MBA. After helping several men optimize their testosterone levels naturally, I've taken everything I've learned to YouTube to help men like you do the same. Without further ado, let's dive into the study. Our past landmark studies, particularly this one by Thomas Travison, found that testosterone levels in men of all ages have declined by over 1.2% per year since the 1970s up until about 2007. This study specifically looked at trends in testosterone levels in young men, which are defined as ages 15 to 39. Between the years 2000 and 2016, so it's a little more recent, they found that 20% or 1/5 of men aged 15 to 39 have testosterone deficiency. The average 22-year-old in this decade has the testosterone levels of the average 67-year-old in the 1970s. Testosterone levels went from 605 nanograms per deciliter in 2000 to 451 nanograms per deciliter in 2016. That's a 26% decline in 16 years, which is highly statistically significant. To put that in perspective, that rate of decline is about 1.4% per year, which is even faster than the just above 1% per year found in the Travison study. If your testosterone levels fell over 150 points like the average in this study, you would definitely feel the difference. Since this study is more recent, these findings show that testosterone levels are continuing to decline, but that they're declining even faster in young men. This is problematic because testosterone is crucial for almost every function in the body. It helps you with muscle growth, fat loss, your brain health, your motivation, your drive to succeed in life. Your libido, your fertility, your ability to produce sperm is contingent upon testosterone. Testosterone also has antidepressant properties, so it elevates your mood and an overall sense of well-being. It's also cardioprotective and neuroprotective, which means it's good for your brain and your heart. The fact that testosterone levels are falling so fast in young men is especially problematic because they're going to go for most of their lives with low testosterone levels. Men with low testosterone are at risk of heart disease, diabetes, Alzheimer's, and overall mortality, which means if you have low testosterone, your risk of dying from all causes is higher. So the fact that testosterone levels are declining in young men is especially concerning because they're going to have a longer time span of exposure of low testosterone. In other words, they're going to have low testosterone for a longer period of their life, which is going to increase their chances of all of the comorbidities that are associated with having low testosterone. All of this begs the question, why are testosterone levels falling this fast? This study looked to see how body mass index affected testosterone levels, and they found that men with higher BMIs, meaning men who are a little bit more obese, had lower testosterone levels. However, men who had normal BMIs also had lower testosterone levels. So this means that having a higher BMI, or essentially being fatter, does decrease your testosterone levels, but men of the same BMI and obesity status still had lower testosterone levels as time went on, which means that there's other factors at play here. The researchers mentioned that diet could be a factor here and that exposure to phytoestrogens could be a contributing factor. The researchers mentioned that diet could be a contributing factor here as the composition of our diets becomes less and less healthy and we're exposed to more phytoestrogens, which are plant compounds that mimic estrogen in the body and can have an antagonistic or negative effect on testosterone levels. They mentioned that changes in diet could alter body composition independent of BMI. This just means that eating a less healthy diet can increase your ratio of fat to muscle, so essentially it can make you skinny fat, and having more fat and less muscle leads to lower testosterone because body fat produces aromatase, which is an enzyme that converts testosterone into estrogen. So the more body fat you have, the more of your testosterone gets converted into estrogen. So the researchers are suggesting that even if men's body weight and body mass index is the same, we're getting more skinny fat, and this is making men have lower testosterone levels due to poor diet. The third explanatory factor the researchers talked about was exposure to environmental toxins, and this is a big one that a lot of people aren't aware of. There's a lot of chemicals in our environment called endocrine disruptors, and they get into our body and negatively affect the production of all types of hormones, but the reproductive system, which is what produces testosterone and sperm count, is especially sensitive to these chemicals. The most common sources of these endocrine disruptors are plastics and pesticides, and interestingly, the prevalence of these chemicals has increased at the exact same rate or over the exact same time frame that testosterone levels have decreased. So there's an inverse correlation between the two. Plastics and pesticides were both invented around the 1970s, and the prevalence of their use has exponentially increased over time, over the exact same time frame that testosterone levels have gone down. Now, of course, there's the question about correlation and causation, but this is what I actually studied in my thesis project, and I found that there is a statistically significant inverse correlation between plastics and pesticides being used more frequently over time and testosterone levels declining over time. In plain English, this means that the prevalence of endocrine disrupting chemicals like plastics and pesticides is having a negative effect on our testosterone levels. And the fourth thing the researchers investigated was the use of marijuana. Although the research is a bit conflicting, marijuana has been shown to have a negative effect on androgen production, and it also reduces sperm count, which is more evidence for the fact that it has an overall negative effect on male reproductive health. Now, these are just a few of the many reasons why testosterone levels are falling. That's a topic for a whole separate video. So to keep this one short, I'm going to move on and talk about what can be done about declining testosterone levels. As of right now, the best solution that most doctors can come up with is prescribing patients testosterone replacement therapy, giving them artificial testosterone. This study found that rates of testosterone replacement therapy use has quadrupled in young men between 2003 and 2013, which is even more than the tripling of TRT use found in older men. This means that young men are going on testosterone replacement therapy at a higher rate than older men. Not only does this reflect the fact that testosterone levels are falling in young men, but it shows that they're falling to such low levels that young men are seeking out artificial testosterone as a solution. And this is problematic because the long-term side effects of TRT aren't really well known. Some studies show that TRT use is associated with an increased risk of stroke and heart attack, but most notably, TRT causes infertility. This is because intratesticular testosterone, so testosterone produced in your own testicles, is required for sperm production, and sperm production is required for fertility. When you take testosterone from outside of your body, it sends a negative feedback system to your brain, essentially saying, hey, we have plenty of testosterone in the bloodstream, so we're going to tell the testicles to stop producing testosterone because we already have enough. And when this happens, testosterone production in the testicles is shut down. And without testosterone, the body cannot produce sperm. And you might think, well, wait a second, they're taking TRT, so shouldn't they have high testosterone and produce more sperm? Well, the answer is no, because TRT is testosterone that's in your bloodstream, but this can't cross the blood-testes barrier, which is a thin cell wall between your bloodstream and your testicles. Testosterone cannot cross that barrier from your bloodstream into your testicles. So only testosterone produced within your testicles can be used to produce sperm. And testosterone replacement therapy shuts down this intratesticular testosterone production that's needed for sperm production. And this is why there's that phenomenon of bodybuilders with shrunken balls. Since they have so much unnatural testosterone flowing through their bloodstream, their body shuts down their own internal testosterone production and the testicles atrophy. So circling back to TRT use in young men, if we're seeing more and more young men go on TRT and they want to have kids one day, well, if they aren't taking the proper precautions, they could set themselves up for lifetime infertility. And even more concerning is that a 2012 survey of urologists, so these are doctors that specialize in male reproductive health, 25% of them said that they would treat infertile males with testosterone while the patient actively pursued conception. So this means that doctors would give patients testosterone which causes them to be infertile while they're trying to have kids. And this just shows an overall lack of ignorance in the medical field about the side effects of TRT. And if there's so much ignorance in doctors that specialize in male reproductive health, imagine how much ignorance there is in primary care doctors who have to try to know everything. So to recap, testosterone levels are falling faster in young men than in older men, and the rate of young men going on TRT has quadrupled, and this is more than the tripling seen in older men, so more young men are going on TRT. And since these young men are starting TRT at a young age, their lifetime exposure to TRT is longer over their entire lifespan, which increases their exposure to all of the possible negative side effects of TRT, one of which has been proven, is infertility. So we could be seeing more and more young guys with low T in this generation going on testosterone replacement therapy, not knowing that it can make them infertile later in life, and then not being able to conceive children when the time comes. All the health effects of TRT aside, going on TRT is a cop-out. Taking artificial testosterone to cover up your low testosterone is the lazy way out. It's no different than treating obesity with liposuction or fat burners. The fact of the matter is that low testosterone isn't some medical condition where you need to take artificial testosterone to make up for it. It's not like diabetes where you have to take insulin because your body doesn't produce its own. Unless you have some rare genetic condition, low testosterone is always a direct consequence of poor lifestyle factors, because everything you do to improve your health improves your testosterone levels and vice versa. So the fact that so many men have low testosterone and are treating it with testosterone replacement therapy is A, an indication that a lot of men are unhealthy, and B, an indication that they either aren't aware of the fact that their poor health is causing low testosterone, or they simply don't want to put in the effort to do the things that would make them healthier and thereby raise their testosterone levels. Everything that's required to have high testosterone, all the lifestyle factors that bring up your testosterone, require discipline, consistent exercise, eating clean, getting good quality sleep, avoiding alcohol and weed and casual sex and porn, not vaping. All of these things require discipline and abstaining from excessive pleasure, which is something that our generation is quite horrible at. And I'm speaking from experience here because I used to be the guy that would work out but then go eat a bunch of junk food. I used to smoke weed. I used to party and stay out late and not prioritize my sleep. I used to drink, and I can tell you what, if you only train and don't address the other factors, you're still going to have low testosterone. And I struggled with that because of all the other negative things I was doing to my health and my overall life. I definitely had signs of low T. My physique wasn't nearly what it was today, and I struggled with erectile dysfunction. And all of this was when I was in my early 20s, when you would expect testosterone levels to be the highest. So the fact that this research is showing that testosterone levels are falling in young men is no surprise to me, because I lived the college degenerate lifestyle that leads to low testosterone. But after I developed the self-control to get rid of all of those habits, not only did my physique completely transform because my testosterone levels were higher, but my erectile dysfunction went away, and I just overall felt like a completely new man. And back when I was a degenerate, I wish there was someone like me who could have just smacked me in the face and said, stop doing all those things, because my quality of life before and after is impossible to exaggerate. So if myself or anyone else who's living that degenerate lifestyle has low testosterone as a consequence, and then they just take TRT to cover up the symptoms, they're still going to go on doing all of the unhealthy things that lower their testosterone levels, and they'll never develop the discipline to truly live a healthier, more well-balanced lifestyle. Because it takes discipline to train. It takes discipline to eat healthy. It takes discipline to not smoke weed and drink alcohol. So if you just take TRT to cover up your low testosterone because all of the negative, unhealthy things you're doing in your life, you're never going to develop that skill of discipline. So falling testosterone levels is a reflection of the fact that this generation of men is less disciplined and less healthy. If you treat your body poorly, it will treat you poorly, and that manifests as lower testosterone. Nothing comes for free in this world. Everything worth having, including high, healthy testosterone levels, requires work. And since our generation's threshold for discipline and work is so low, it's no surprise that our testosterone levels are low as well. But for all the men out there with low testosterone who are willing to develop their discipline and their work ethic, I've built out an entire course that walks you through all the steps you need to take to maximize your testosterone levels naturally. So if that's something you're interested in, check out the link in the description.